default mode interference. So I've talked about this before on previous episodes. Default mode interference, you have two main brain networks. You have your default mode network, which is your self-talk. It's the default. It's also what's known as your ego. So when you're kind of just sitting there doing nothing, daydreaming, your ego is the self-talk saying like, oh, I got to pick that up from the grocery store later, or what did I, where did I misplace my phone, or you're just kind of self-talking through things. You're thinking about random things. You're not necessarily doing anything task specific. You have another network called your executive network. Your executive network is what is the task at hand, right? You're doing a math test. You are dialed in to that. You're doing whatever task you're doing and you're 100% focused on that. I'm sitting here talking to all of you. My entire focus is on this right now. I'm not thinking about things I have to do later or anything else. I'm focused on this right now. That's my executive network. These two networks, the executive network and the default mode network, cannot be active or should not be active at the same time. If they are both active at the same time, you get what's called default mode interference, where as you're trying to focus on a task, you keep having random thoughts coming into your mind, which is distracting you from the task, which is going to not only affect your performance on that task, but also now you're using twice as much brain power to get the same or even a worse result. So this is what's called default mode interference. In patients with persistent concussion symptoms, when they do studies on fMRI, where they'll put them into the fMRI machine and they'll look at brain activation patterns and which regions of the brain are active, if they give you a task, if you're a normal healthy control person and they give you a task, what you'll see is when you're in the fMRI tube and you're trying to perform a task, your default mode network will shut off and your executive network will turn on. If you have a patient with persistent concussion symptoms and you put them into the fMRI tube, what you'll see is that the default mode network doesn't shut off and the executive network tries to kick on, and so you got activation of both networks simultaneously. So now you're burning twice as much energy to get the same or even potentially a worse result on your cognitive task. So that is going to burn energy. Here's the thing. They find the same thing, this default mode interference, they find the same thing with people with generalized anxiety disorders and post-traumatic stress disorders. So one way to shut off the default mode network interference is by reducing your anxiety. So remember what I said, the default mode network is also called the ego. It is your sense of self. It's who you are. It's your self-talk. It's your little voice. This is the ego. The purpose of talk therapy and therapeutic interventions on the psychological front usually is to try and penetrate the ego, right? Try to get into that self-talk. Try to, help to make that self-talk more positive and more appropriate for, your day, your life, for reducing stress and everything else. Patients that have anxiety that's incurable because they've tried medications, they've done all this stuff. People generally with end of life anxiety, they have terminal cancer and they're going to die and they're afraid of dying. They'll have anxiety around that, and medications just typically won't work. Talk therapy typically won't work. What's being done now? There's research now being done on hallucinogenic medication like psilocybin, LSD, MDMA. So these are the kind of hallucinogenic class of medications that were, studied way back in the day and then became more of popular culture type drugs. But these drugs, when they study them, are actually very effective for people with anxiety that's not treatable by any other means. People that are not able to get rid of their anxiety in any other way will actually have a very profound effect by having one guided session with psilocybin, which is otherwise known as magic mushrooms, with a therapist. Having one guided session has been equivalent to having 10 years of therapy. And when they first started trying to figure out why this was working, researchers would take these patients on these medications and they would put them into an fMRI tube. And what they were expecting to see was just like activation of the brain going crazy and activation of all these different networks. And what they actually found was the executive network was extremely active. The default mode network was completely silent. So all of that self-talk that's going on inside your mind, which is your own voice, which is a lot of times the things that holds us back from doing things, it is our anxiety. It was completely shut off. So the idea here is then if you can shut that off through these medications, you're able to penetrate the ego and have a profound effect on somebody's internal psychological workings. What's interesting about all of this is that they also find the exact same phenomena in people that are experienced meditators. So I'm not condoning you to go out necessarily and start taking magic mushrooms or anything like that. But if you get really good at meditation, you can have the same type of effect where you can actually shut down the default mode network, activate your executive network, right? Because meditation is all about mindfulness and having your experience. You're looking at everything, your breathing rate, you're feeling what it's like to feel your breath through your abdomen, you're feeling, your skin, your hands, feeling what it's like to have, a head and a face, and you're doing all these things which is completely in your experience, which is your executive network. That shuts off your default mode network. And if you get really good at this, you can actually activate this throughout your day, which is one way to reduce this default mode interference. So now rather than burning multiple sources of energy and having both networks active, if you can figure out a way to reduce your default mode network, then you can potentially conserve energy and be more proficient at whatever tasks you're performing.